If interventions are overused, then why are mothers and babies still dying in childbirth? I'd like you to say this with me now. Intervention does not always equal a better outcome. It also doesn't always save lives and can also sometimes cause harm. If you haven't met me yet, I'm Angie, I'm the eco midwife and I'm a practicing midwife here in the UK. And I absolutely love intervention from the perspective of we have access to inductions, we have access to caesarean births, we have access to fetal monitoring, we have access to be able to have lots of different things during our pregnancy, labour, birth and beyond to be able to help us. But it is not the be all and end all, and it's far more complex than you have an induction, it will save your baby, you have a caesarean birth, it will save your baby. It's very complex as to why babies are still dying with the increasing intervention rates. And we can look at this from a country-based perspective. So you look to America right now, the maternal mortality, the stillbirth, the neonatal death rates are huge, and they have one of the highest countries in terms of interventions for inductions, in terms of caesarean births, and their maternal mortality is increasing, particularly without the access to safe abortions, safe terminations. You look to countries like Finland and Norway where they have lower intervention rates. You look to some other European countries who have reduced their caesarean birth rates over the last couple of decades, only by a couple of percent maybe. And their neonatal mortality, stillbirth rate, maternal mortality as well, so maternal death rates, have either stayed steady or they have dropped further. We are one of the worst performing in the UK, and yet we have one of the highest climbing intervention rates in terms of inductions and caesareans, without the relative comparative data to say that our stillbirths and our neonatal deaths are dropping at all. In fact, they have actually increased over the last few years, and we have seen a significant increase in caesarean births and inductions, but yet the mortality rate, both in neonatal terms but also in terms of mums, has increased. And if we look at maternal mortality as a starting one, when you look at the data, you can see that we were dropping in maternal mortality, so less women were dying in childbirth till about 2012. Then austerity measures kicked in, NHS pay freezes kicked in. We then didn't see an improvement in any maternity care or any drive or initiative for quite some time, for at least 3 or 4 years, and that maternal mortality started increasing here in the UK. The same with perinatal mortality for neonates and stillbirths. And one of the best ways to improve outcomes is to reduce preterm birth. If we could stop and prevent women going into preterm labour and preterm birth, we would have a much lower mortality rate, because most of those deaths sadly happen in babies in much earlier gestations. And that is something that the government haven't massively pinpointed on. It's in Saving Babies' Lives Care Bundle, absolutely there are some initiatives, but there are some massive initiatives that can make the biggest difference, and it's been completely sidelined. And the things that are not being factored in are the long-term harms caused by increasing intervention rates. So I'm going to give you the example of caesarean births. Caesarean births, if you have one in the past, you're more likely to have a uterine rupture, more likely to have a stillbirth, more likely to have an ectopic scar pregnancy, more likely to have a placenta previa. All of these things impact the mortality rate in your future pregnancies. That in itself has caused harm by having that first caesarean birth, and that is something that we are starting to see a massive increase in terms of maternity wards, the women who are staying for placenta previas, for example, the women who are then needing to have a premature birth, which then increases the neonatal death rate further down the line. That all has harm, so it causes iatrogenic harm. So that one birth that first happened, that's what then causes the increase in mortality further down the line. You don't see it immediately, but you see it in the next pregnancy and the pregnancy after that. And as a midwife, I'm not saying that women shouldn't have induction, they shouldn't have a caesarean birth, absolutely not. It should be an individualised management plan based on what that individual woman's history is, because like I've said at the start, caesarean births, inductions, lots of different interventions, that continuity of care, going to your antenatal appointments, testing for things like preeclampsia, for diabetes, everything, all of that can have huge benefit in dropping and reducing the mortality rate both in mums and babies. But when it's overused, over-medicalised, when we're doing these things without a medical reason, we then start to see the knock-on impact 2, 3, 4, 5 years later, where then we start seeing that increase. And you can see that from caesarean birth in itself. the neonatal mortality rate, even with planned caesarean birth at term, is higher after a caesarean birth than what it is for a vaginal birth, for example. However, we do need to take that into context that there is a higher mortality rate during labour and birth and pregnancy with people going for a vaginal birth compared to a caesarean birth. All these rates are very, very low, but it's just highlighting that it's very difficult to compare intervention with having a better outcome overall when you look at a global population perspective. And what really has the best outcomes is having people who are healthy going into pregnancy, having that good preconceptual care, having continuity during pregnancy, having real investment in maternity and obstetric services so that women have the same person each time, they have that support, they have that care. And that's what has the biggest impact in outcomes. Having healthy lifestyles, healthy diets, being able to exercise before, during and after pregnancy, quitting smoking before pregnancy as well, having no smokers in the household, thinking about things like alcohol and drugs and medications, again, optimizing those. And that's something that we can learn from other countries which will have the best outcomes, but we haven't yet hit the nail on the head with that. To conclude, intervention in the right women absolutely does improve outcomes, but when it's overused and overutilized, it actually causes iatrogenic harm. We start to see the increases in mortality both in mums and babies, as we are now seeing now.